Hello, everyone, and welcome to part 3 of our lecture on Chapter 4 Multicultural Considerations in Assessment. In parts 1 and 2, we provided definitions of multicultural assessment, fairness, bias, and talked about different cultural conditions of assessment. And in this third part, we're going to continue that discussion by starting with the concept of a culture fair test. And a culture fair test is designed to help reduce the use of language and cultural content so that tests are more suitable across cultures. Primarily, what this means is that a culture fair test is a more nonverbal test because it removes the aspect of language and any cultural context that comes into the information that you're taught or definitions of terms and things like that. And we use the term culture fair instead of culture free because not all bias can be eliminated from a test. And most often, when we use the term culture fair test, it's associated with intelligence tests. Although culture fair tests do tend to be nonverbal and they do help reduce bias, they still possess some limitations. Namely, they tend to measure a much more narrow range of cognitive function, and they're not strong predictors of academic and work performance. So if you are working with a client and you need to be using a culture fair test, and you also have a client who is needing the assessment to be for academic or work performance issues, you really have to weigh out with the client the benefit and drawback of using this test because it is limited in that capacity. There are some common features of culture fair tests, such as if they are progressive series completion, which is where you have a progression of images that are related to one another, and you ask the client what image would come next out of a set of 4 or 5 options. You can also have object classification tasks. This is similar to the alpha beta or the Army beta test that you saw in our lecture on chapter 3, where you're asking someone to identify what is the name of something in an image or what's missing from an image. We also have identification of change patterns in figures, which is oftentimes called matrices or matrix reasoning, where you have an image that almost sort of creates a puzzle, and the client has to figure out what piece of the puzzle will complete the puzzle based on how the pieces are related to one another previously. And they're different from progressive series completion because progressive series completion tends to be a linear line, whereas matrices tend to be in like a 2x2 format. We also have selection of a figure that differs from a set of other figures as an option, as well as identification of figures that are similar to an example. So using condition-based reasoning to say, these images fit together, what other image might fit with this sort of condition based off of that? And it's important to know that some culture fair tests do require individuals to draw a whole picture of a person or to tell a story about a scenario on a stimulus card. And our book goes through quite a few different examples, and I have those on the slide here where our textbook actually provides you with a sample question out of those tests, and they also provide some additional culture fair tests but they don't provide examples, so I'm going to go over a couple of those with you here. The first of those is the Nagleri nonverbal ability test, which is a progressive image matrices sort of hybrid where you are having the client look at how these images are related to each other and how they change over time, and then based on the change in the top 3 images, deciding which of the bottom images would go in that white square. We also have the Wechsler nonverbal scale of ability, which as you can see is very similar, where you are looking at the relationship of items both vertically and horizontally to determine which of the items below will go into the blank square above. We also have the Tell Me a Story, which is called the TMOS for short. And the Tell Me a Story is exactly this. It is this image on the screen where you present this in a stimulus card to your client and you say, tell me a story about what's going on. what was happening right before this image was taken, what's happening during this image, and what might happen next. And you're recording down exactly what the client says and using that as your interpretation. And we also have the Columbia Mental Maturity Scale, which is a particular culture fair test where you ask the client to select the drawing that does not belong out of the set. So in this image, these are actually 4 separate questions. So each line is a new question, and you would ask the client to point out or indicate to you which one of the items does not belong with the others. And I present all of these to you because I think it's important to know what some of these assessments are, because even if we are not going to be practicing the actual display of them or the utilization of them in the second half of our course, it's still helpful for you to know what some of these items look like, because you may be asked to use these with some of your clients, or you may be asked to interpret these because your clients have had an assessment conducted somewhere else. Also, it's important for me to also let you know that all of these images are from the actual assessments that have been listed, and it is your ethical responsibility as researchers and as assessors to make sure that you are securely storing these images. So that means that you're not sharing these images with individuals outside of this class, you are not sharing these with your family members, you're not conducting these assessments with others that you know well, because that is going to invalidate the use of these assessments, because the materials cannot be displayed outside of an educational purpose. Also, I think it's interesting that because you have seen the images of all of these images from all of these assessments, you actually cannot take these assessments for yourself, as the results would also be invalidated because you've already seen what the questions and answers might look like. Another type of testing that we talk about in the context of multicultural assessment is dynamic testing. And dynamic testing is a beneficial tool that we can use to help further reduce any performance gaps that exist between dominant and minority groups, even after the use of culture fair tests. Because we do have these performance gaps that still are displayed even through culture fair tests, and dynamic tests are our way of further reducing that performance gap. So the way that dynamic test works is you have someone come in and you present them with a problem-solving task, but you give them very minimal instruction on how to solve the problem in front of them. And as the assessor, your job is to sit back and watch what metacognitive skills the client displays in trying to ascertain how they want to solve the problem that's in front of them. And once you see the client do that the first time, you observe and you make an informed judgment on what additional instruction would be needed for that client, and then you see how the client responds after you've given them that instruction. So individuals are then scored based on their ability to learn from the immediate instruction, as well as any feedback loops that come into play with the problem-solving task at hand. One common dynamic test is the Animalogica test, which is an example of a dynamic test used with children that utilizes colored images in a 2x2 format. And we most often use this with children and ask them to use logic to figure out what image is missing from a set of other images. So most often a child is presented with a 2x2 square and 3 of them are filled with pictures of animals. And we ask them to ascertain what the missing figure is in that image. And the test involves the use of 6 different transformation rules so that the children can then use to solve the analogy. Those different transformation rules include animal, color, size, position, orientation, and quantity. So here is an example of the Animalogica test. So these are two separate stimulus cards for the Animalogica test that you would present to the client. And you would say what would go in the blank square. And then you would listen to what the client says and follow their logic. And again, they can be scored on 6 different categories, and their reasoning for it is what helps gain them points in this type of assessment. So we've talked about culture fair tests and we've talked about dynamic testing, but I want to take a little bit of a step in a different direction and talk about the use of assessment with folks who have disabilities. Because throughout the United States for the last 100 plus years, we have seen quite a bit of change in how we talk about and how we identify, as well as how we accommodate disabilities. And I want to go through a little bit of that history with y'all. One of those is Section 504 of the Rehabilitation Act of 1973. This particular section requires that accommodations be made for students with disabilities so that the particular test measures the construct it is intended to measure rather than the disability. We also have the Education of All Handicapped Children Act of 1975, which requires that an individualized education program be developed for students with disabilities. The individualized education programs are developed by multiple professionals within the school, along with the students' parents, and all of those individualized education plans include a statement of the student's present level of performance and needs, a statement of what special educational services are to be provided to meet those needs, and a valid measure of annual goals and short-term objectives. We also have the Individuals with Disability Education Improvement Act, which addresses the use of high-stakes testing with students with disabilities. And I bring all of these up, even though they are focused more heavily on the school setting, because a lot of times as counselors, we're going to be seeing clients at various points in their life. And there is a highly likely chance that you are going to be interacting with someone in your clinical work who's in school or dealing with a school system in some way, whether that's for themselves or for a loved one. And there's a chance that you might be asked to understand and help the client navigate these laws, as well as understand what their options are if they're needing an assessment in school. And right now, especially in the United States, school counselors are usually the individuals who play a pretty important role at schools by helping to ensure that appropriate test accommodations are made for students with disabilities. So if that means getting extra time or having additional attempts, or just even being able to pause an assessment or a test and being able to come back to it. Oftentimes school counselors are the ones navigating that, but outside of a school setting, that obligation is going to fall on you as the assessor. There are some national testing programs, such as the ACT and the College Board, that offer special test forms and other test accommodations for students with disabilities. So make sure that you're utilizing those if you need, because research regarding testing for students with disabilities consistently indicate that individuals with disabilities tend to score comparable to their peers without disabilities when appropriate accommodations are made. And what that means is that as assessors, it is our responsibility to make sure that we are making those accommodations for our clients so that our clients can truly demonstrate their skills to the best of their ability. There are also two primary measures of adaptive ability that are often used for folks with disabilities, and those are the Vineland Adaptive Behavior Scales and the Supports Intensity Scale. And both of these assessments provide information on an individual's daily living skills as well as their social, behavioral, and physical skills. Interestingly, both the Vineland and the SIS are both interviews that can be conducted with the client, with loved ones, with teachers, with parents, with caregivers, and the people around them so that you can get a comprehensive view of that individual's daily living skills. And finally, I want to talk with y'all about the use of assessment for folks who are older. So, the number of individuals who are classified as quote unquote older living in the world right now has grown dramatically. In the United States alone, 1 in 7 people is more than 65 years old. And by the year 2025, this figure is estimated to be 1 in 5. So, around 20% of people in the United States in 2025 are expected to be 65 years and older. And because of that, there's a tremendous push amongst counselors to know how to effectively utilize and engage in assessment for folks who are over the age of 65. One of those assessment measures is the clinical assessment scales for the elderly, which is a useful tool for providing information regarding Axis 1 disorders among the elderly population as classified by the DSM. So, Axis 1 is most often neurocognitive disorders and disorders of cognitive decline. And the clinical assessment scales is really going to be helpful in identifying whether or not someone is experiencing one of those so that it can be added to their medical record and then be treated accordingly. We also have the mini mental status exam, which is often used as a cognitive functioning measure and mental status because it's so brief. It typically only takes a couple of minutes to administer a mini status exam, and the questions are pretty easy for counselors and assessors to pick up on. So, a lot of the questions from a mini are saying things like, what is today's date? Who is the president? Or asking the client and saying, I'm going to say 3 words and I want you to repeat them. Are you ready? And if they say yes, then saying to them, book, chair, tree. Then asking them another question, something like, can you tell me what this is? And you point to an object in the room and you ask them to identify it. And then you go back and you say, you remember when I asked you those 3 words before? Can you tell me what those are? And you see if they can repeat them back to you. And you might have another question that is asking the client to read a stimulus card that has a specific saying on it of an action to do. And you say, I want you to read this card and do what it says. And you show them the card, and maybe on the card it says something like tap your nose. And you watch and make sure that they follow the instructions and engage in the behavior. So the mini mental status exam is particularly helpful because it is so quick, as you can see. Another assessment that's common is the Wechsler Memory Scale. And the Wechsler Memory Scale is actually gained a lot of increasing use recently because of its ability to measure memory function amongst the elderly population. So the Wechsler Memory Scale is actually most often just called the WIMS, the WMS, because it's much easier to say. But in addition to assessing memory, the measures within the Wechsler Memory Scale are oftentimes paired with activity checklists so that the assessor can determine not only is this individual's memory intact or impaired in any way, but also here is how it is influencing their daily living skills, which can give a really comprehensive view of someone's adaptive functioning over time. And also, it's important to keep in mind when you're doing assessments with older adults that as a counselor and assessor, you need to be aware of possible fatigue during testing and the influence of medications on the results of your assessment. So that means potentially scheduling shorter testing sessions more frequently, or even just scheduling them around specific medication dosages. Whatever that looks like will vary by the person, but making sure that you're having that conversation with your client. Also, after testing is completed, you need to make sure as a counselor that you are interpreting the assessment data in a way that makes sense for the client. And this is particularly important for older adults because oftentimes they might come to you and say, I want to test my cognitive function now because I want to see how it's changing over time because I was just diagnosed with this thing and we need to be able to assess what my cognitive function is over time. So your assessment might be some sort of baseline against which that individual is going to compare future changes in their cognitive functioning. So it's helpful to know why someone is receiving an assessment and to know what the purpose of it will be so that you can best utilize the assessment time with the client and provide them with an output or a report that is going to make sense for what they're needing. So that is going to wrap up our conversation on chapter 4. As always, here are the questions in review of this chapter to help you study and to make sure that you're understanding the content. And I will see you all in the next lecture.